With Cape Media News Conversations, I'm Sarah Colvin. Pleased to welcome in studio for our monthly update our Cape and Island State Senator Julian Cyr. Julian, welcome. Thank you so much for joining us.
Glad to be back.
How's it going?
It's good. I mean, this is sort of the busy crunch period in the legislature. So we have about 6 or 7 weeks before the end of the legislative session on July 31st. So it's just a flurry of activity, a lot of time back and forth up to Boston. Thank God the bridges are back open, and that was a real relief.
Yeah, but I can imagine. I got stuck in traffic, I think, 4 times, but I don't have to go to Boston nearly as much as you do, so I'm sure that put a damper in trips. But nice job for them getting that done so quickly. So we have a number of things to talk about. Lots of funding, of course. That's the majority of the work that's done is bringing funding here to Cape Cod. Let's start talking first about anti-addiction programs in schools. So important as we continue to deal with a major opioid crisis. Getting kids in young and learning about anti-addiction important. So tell me a little bit about where the funding is going.
So this is part of our budget, right? And the budget is the sort of biggest thing we do in the legislature. We have an over $40 billion budget in Massachusetts. The House takes up the budget in April. The Senate, we just took up our budget at the end of May. And so this specifically is $50,000 that I was able to secure in the Senate budget that's going to go to schools here on Cape Cod around addiction intervention, but especially addiction prevention work. If you look at the data on who's impacted by the opiate epidemic here on Cape Cod, Barnstable County did a great look back on data of basically who's impacted actually, who are the individuals who are dying of opiate overdose. And that data shows that 69% of those individuals are straight to work. So they have maybe a high school education, maybe they don't, but they're not going on to further education. So, and 1 in 4 of those individuals are employed in trades and construction. So from an intervention perspective, that really gives us a sense that if we're really going to stem the epidemic from starting, or for someone to being addicted, we've got to start when they're in school, and we've got to target that population, especially that straight to work population. So this $50,000 is going to realize that. I think we're going to see, really be able to see an expansion of the services that Commerce Choice provides, not only at the high school level, but also the middle school level. And increasingly, there's really good data and research around even beginning to do some of this work in elementary school.
Sure, and what I like about Commerce Choice is that it's not specifically an anti-drug campaign. It's really teaching kids coping skills that they need, ways to kind of deal with those emotions, ways to deal with some of the hardships that life can deal to you that might make it easier to turn to drugs. And it gives you those tools in your toolkit to be able to go on. And I think it's great to have that. That's not necessarily just a say no to drugs. It's here's an alternative to make yourself feel better.
And it's really based in evidence, right? And looking at human behavior and why we use in the first place. And if you look, even if you look at the difference between if someone uses a drug before they're 18 versus when they're over 21, the likelihood of them being addicted really changes. So if you're under 18 and under, 1 in 4 individuals are going to become addicted to that substance. If you're over 21, it's 1 in 25. So that toolkit, those skills, also really provided in a real evidence-based interventions, I think is something that hopefully is going to make a difference. If you look at where this epidemic is going, we've seen a plateau, but we haven't seen a decrease. And so part of that is making sure that the next generation of Cape Codders that are coming up have more resiliency when it relates to opioids and other drugs.
Wonderful. So that's just the tip of the iceberg on the things that we are going to talk about today. The second thing I want to talk about is money for sheltering for homeless and an outreach study. Of course, again, another huge hot button issue on the Cape is homelessness and looking for ways to solve that. So tell me a little bit about the money funding for that
So what this aims to do is one of the most effective interventions actually for the chronically homeless has been led by the Barnstable Police Department and their Community Impact Unit, a marvelous group of folks helmed by Sergeant Jennifer Ellis. And they brought together entities that are providing shelter, behavioral health folks, the police, community members, the hospital. And what happened actually, these big storms that we had, specifically that January 6th storm, where you had a really long kind of period of cold, they scrambled, led by the police department, to get folks into shelter. Right. These are chronically homeless people, right? These are people we can't even get into the shelter. And so this is going to provide resources and money to do that in the future and to continue to really support the Community Impact Unit program. Again, this really great partnership between law enforcement, community service organizations. I think it's actually made a real difference in Hyannis,
right,
and also in West Yarmouth as well. And this sort of is going to allow them, money goes to the police department. It's going to allow them to keep that up.
Absolutely, and you know, Jen Ellis has said to me, you know, we're never going to completely eradicate homelessness, but to be able to provide ways for people to transition out is certainly very important.
That
That's all you can do.
You know, that continuum of services, whether you're talking about someone who's struggling with addiction or homelessness or mental illness, and often the three are interwoven.
Absolutely.
You know, that's exactly, and really glad to support the police department in doing that.
Sure. And again, going back to the opioid addiction, Narcan has been something that our first responders have had in their toolkit that's able to help people, really saving lives here. And so I understand there's some funding coming in for a bulk purchase of Narcan.
So the state actually has a program that provides bulk purchase of Narcan to law enforcement and to first responders. But we don't yet have a program to get that Narcan at a really reasonable rate to nonprofits, to community health workers and others. And so this would provide $20,000 to do just that in Barnstable County. Again, you know, in looking at this epidemic, all right, how do you prevent people from getting addicted in the first place? And then how do you have interventions that save lives and then get people into treatment and provide that continuum of care?
Great. And child advocacy, of course, at Children's Cove does a wonderful job at helping children who have been victims of sexual abuse. I understand there's some funding coming their way as well.
So this is something that actually really irked me when I found it out. So these child advocacy centers, and Children's Cove is one of them, but we have a dozen across the state. These are the entities that are providing the support and services to children and families in probably some of the toughest situations you can imagine, right? When a child has been abused or part of some sort of abuse, whether it's physical or especially sexual abuse. And these currently have been funded through earmarks in the state budget, which are pretty unstable. Earmarks tend to go out of fashion, especially when we have a recession, and they're subject to, actually the legislature has been in a bit of a tug of war with the governor around earmarks.
Can I stop you for a second? Just, do you have a basic description for those who might not be familiar
with what
an
earmark
is? Yeah.
So an earmark is sort of a specific priority that a legislator or an administration sort of puts into a budget line item, right? So you know, you could have an earmark for $5,000 to the Sarah Colvin media internship training program, right?
And it kind of piggybacks onto another bill. Is that the kind of thing?
Or onto a line item within the budget,
sure.
Right? So this is the earmarks are sort of how legislators identify community priorities.
Great.
But I really felt that these programs are so critical and crucial. This should be sort of baked in to funding that comes from the Department of Children and Families.
Sure.
There should be some formula to do that. So in the budget, I led an effort working with my colleague Mike Rodricks from Westport to begin to move away from having an earmark system to actually making sure these programs, including Children's Cove, get the adequate training, adequate funding that they need. For Children's Cove, that's going to be $140,000. But sort of a big win in making sure that we're doing our due diligence as a state to provide those services for folks and not have it be subject to earmarking and other pieces like that.
Wonderful. And of course, just to remind our viewers, we are talking about a number of initiatives that are getting funded in the current budget process. So many things going on. Barnstable County Fire and Rescue Training. We've got a great training academy in Barnstable that helps our firefighters. So tell me a little bit about this.
So this is very crucial for firefighters across Cape Cod. So the only other training facility in the state is in Stowe, not Stowe, Vermont, but Stowe, Massachusetts. So for those who don't know, that's up in the sort of north central part of the state. So it's a schlep for sure. So the county maintains a fire training academy. There were some challenges and concerns about environmental contaminants there at that site. That has been worked to clean up. There's been efforts to clean that up, and so these are dollars actually. There's actually it takes a portion of monies that would go to Stowe and make sure that it comes from Cape Cod here, so we have some funding.
Wonderful, because we don't need them to go driving all the way out to that.
And we're actually working to sort of expand, hopefully looked at, how do you expand this as a resource that other southeastern Massachusetts communities can use, because it's probably closer to come here to the Cape than it is to go certainly kind of further into Stowe. But there were some contaminant issues. Those are being worked on to be addressed. Certainly water quality is really important. So something that we've worked closely on. Yeah.
Great. Housing, another big issue here.
Yep. Housing. There's some money in the budget around two big housing issues. One, to continue some of the community outreach programs for people who are really on that edge of homelessness. A lot of people are what we would call housing insecure, especially older adults and older folks who really struggle to maintain their homes. We haven't done a good job building housing stock for seniors to downsize into.
Right.
And so this provides money to the housing, the community housing programs here on the Cape, and also was able to secure a significant increase, $800,000 more in monies to the tenancy preservation program, which is part of the housing court. So housing court last year, if you viewers may recall, if you were following this very closely, we were able to expand housing court to Barnstable County.
Sure.
And this is following up with resources for that housing court. So,
Great.
so all sort of important housing priorities. We've got a lot of work to do in housing.
Absolutely.
This hopefully helps.
Definitely, and
Yeah.
it's on both ends of the age spectrum, right? It's for young professionals trying to get into workforce housing, older people trying to downsize,
Yep.
and of course competing with the second homeowners and the rising home costs. It's just unbelievable.
Yeah.
But I will say
Yeah.
that I've seen a number of projects that are in proposal and some in development that are working to help with some of those issues. So we're looking forward to better housing here on Cape Cod.
Yeah, and I think it's really important you pointed out when people talk about housing, they tend to think of folks who look like you and I. But really, there's a big need for older adults.
Absolutely. Indeed. So very good point. And the more older adults they can downsize, the more housing that's available for folks like you and I,
Precisely.
or folks younger than you and I. Let's talk a little bit about the Employer Medical Assistance Contribution Hardship Exemption. That's a mouthful. What's that all about?
You're like, what the heck is
like,
that?
what is this?
So this, last year in last year's budget, there was a proposal put out by the governor to recoup some of the monies that Mass Health and the Connector are paying for employees who are opting against taking employer-provided health insurance and going with state-subsidized plans. And the reason folks are doing that is because the plans that the Commonwealth offers are pretty robust, and they tend to be cheaper than what an employer can provide, especially a smaller employer. And so this sort of quote-unquote EMAC, this Employer Medical Assistance Contribution, the governor proposed it at $2,000. The legislature pushed back, and we negotiated, and it finally came out at $750 per employee per year who is on a public health insurance plan when you offer health insurance. This has actually turned out to be a really big burden on small businesses, a really big burden on nonprofits, and on entities that in the public service, like skilled nursing facilities. Because the cost of health insurance just goes up and up and up. I talk to employers who will see a 20% increase in the cost of their premiums year after year. And so it's just really hard for really hard for employers to be competitive. And so what we got into the Senate budget, this is a pretty big deal, is it essentially directs the administration to say, look, for certain employers, small businesses, seasonal employers, seasonal businesses, employers in the public good, nonprofits, you've got to come up with some sort of hardship exemption waiver for these entities because this EMAC has become a really big burden and is really, especially for entities that have tight cash flow, which tend to be small businesses, food service entities, nonprofits. You don't have a lot of cash on hand. What's been happening is you get this sort of unexpected bill from the Commonwealth for $15,000 for this EMAC surcharge. It's due by the end of the month. Where are you going to get that money? And it's been a real headache, a real concern. So the Senate's led on this. I hope the House is going to agree to this proposal and we'll get it into law.
Yeah, and I feel like that was one of the topics that came up during the retail tour that you and some of your colleagues took when we were sitting at Alberto's. A lot of the small businesses said this is a big burden for us. Healthcare costs are very expensive. Is there a way for us to kind of work with that? And it seems like this is.
And we just finished and put out the report from the Retail Task
fantastic.
Force. And the best part about it, well, I'm a little biased, but the best part about it is there's all this fabulous information about Cape Cod. But we talk about how for employers a real challenge that retailers have is meeting mandates and the sequence of those mandates. So most of the employers we talk to here on Cape Cod, pay their employees well, want to provide benefits, want to provide services, really care about their employees in the community. They just need some predictability in that. And EMAC has, that we've been talking about, this amendment I filed, has been part of that challenge and that predictability.
Wonderful. Last thing we want to talk about is the Pilgrim Nuclear Power Station decommissioning. Certainly a massive project, and I know from what I remember, the plant is scheduled to go offline in 2019, right? Is that
in
next
May
year?
2019.
Yeah.
And this is sort of the most critical period we're going into around the life of this plant, right? Because whether or not you and I are talking about this plant for just a few more years or for another decade or two is going to depend how we go about decommissioning the plant. So the legislature worked, prior to me joining the legislature, worked to establish a decommissioning panel. I actually, when I was an aide, helped to kind of draft that, working with my predecessor and with Sarah Peak. So that panel has been convened. They've issued a series of recommendations. And we have felt, working with them from a delegation, that there's a few things that we need to see the administration doing. We need the administration to be convening an interagency working group that's going to bring together all the various state agencies that have some sort of role here. That's emergency management, it's public health, it's public safety, it's environmental protection. Make sure you get everyone to have a seat at the table. I filed a bill last fall that would require the Attorney General to have some oversight here. She's now going to be a part of this as well, which is good to just have, the people's lawyer on board. And so what this amendment does is it essentially directs the working group, provides a little more teeth for what the Commonwealth can do as it relates to this plant, and then provides monies to the administration, not big monies, but to coordinate that work. But this is a really critical piece that we have with Pilgrim here, and we really need to ensure that we have swift decommissioning. We need to ensure that the spent fuel that is in that highly volatile spent fuel pool is removed from that pool. Worst case scenario, it's in dry cask storage.
Sure.
A better case scenario is it is removed off the site, but getting that out of that spent fuel pool. And that's what this amendment is meant to do, to really hold Entergy accountable to make sure they have a swift decommissioning.
Sure, because as we know, it's not just a matter of flipping a switch, it's years of work
years.
that's going to take to disassemble that plant. All right, well, Julian, thank you so much for all of the work that you're doing. And of course, if folks would like to get in touch with you, if they'd like to chat with you, what's the best way for constituents to talk with Senator Cyr?
So probably the best way, call my office. The number is 617-722-1570. You can also shoot me an email at julian.cyr@masenate.gov. I've got a great team. All my staff who work with me are all Cape Codders. And so either myself or someone on my team will help, whether it's a constituent issue, if you've got a question on legislation. This is really the kind of key time where we're really ramping up. We're going to be passing an environmental bond bill around climate resiliency. We're going to be passing a climate change bill. Later this week, we're taking up a bill around further gun control protections. So a whole host of things that are coming up. So now's the time to chime in.
Wonderful. Julian, thank you so much as always for stopping by.
Always a pleasure.
Thank you. Cape and Island State Senator Julian Cyr joining us for Cape Media News Conversations. I'm Sarah Colvin.